Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, cosmetic surgery after massive weight loss. With us, we have Dr. Frank Stile, board-certified plastic surgeon. They call him Las Vegas's hottest plastic surgeon because of the results he's getting from his patients. Dr. Stile, welcome to the program.
Hey, Randy. Glad to be
Always
back.
a pleasure to have you on the program.
Always glad to be here.
Now, before we get into today's topic, for those that don't know who you are, about your practice, tell us about it.
Well, I have a cosmetic surgery practice in Las Vegas. It's one of the busiest practices there. We do everything from facial plastic surgery, cosmetic surgery of the breast, including enlargement, lifts and reductions, and body contouring procedures, including tummy tucks, liposuction, and now my practice has expanded to include services and procedures that cater to the massive weight loss patient. This is a unique population that requires special attention. Their surgery is a little bit different than the average cosmetic surgery patient.
That's a very popular procedure nationwide, these weight loss surgeries.
It's getting more and more popular as the number of patients who have had surgical procedures to address their weight issues like gastric bypasses and gastric banding. There are a new set of problems and challenges that these patients face after having these procedures. They basically have traded one type of deformity for another. They've struggled with weight issues for most of their lives. They've taken the chance, both an emotional investment, a financial investment, and in some cases a surgical risk to have a procedure to lose all this weight. And once they've achieved that ideal weight, what they realize is that they're left with a new set of challenges and issues that the skin...
I mean, just a dramatically... just loose skin all over their body. I mean,
right.
You showed me some of these pictures, and we're going to get to those photos in
The
a
skin
moment.
issues aren't only a cosmetic issue for these patients, they're a functional issue as well. It interferes with their quality of life to some degree, and that's in terms of exercise tolerance, ability to make choices, certain choices in terms of clothing, and even intimacy issues.
Now, these people lose about 150 pounds apiece, 200 pounds apiece,
80
and they're doing it very quickly. Is that the problem? Is that why the body is not bouncing back?
No, the skin, what's good about skin is what's bad about skin. We've talked about this before. Skin stretches, and the elasticity of skin is great, but past a certain elastic limit, it won't come back. And these patients lose an average of 80 to 200 pounds after these procedures. The range is large. They do have a certain amount of skin retraction, but it is impossible to ever get all that skin back to where it was prior to them gaining weight.
So, I mean, just about every patient that gets the surgery, this weight loss surgery, they need to get cosmetic surgery afterwards. One way or another. I mean, if you lose 150 pounds in 6-8 months.
Well, they have skin issues that require, there's no typical weight loss patient, first of all.
Okay.
These patients require different procedures. It's different from men and women. Women require to have issues with their breasts addressed that men don't have. Women require lifts or enlargements. Some of them still require breast reductions. No patient is typical. Each patient is unique, and they have a unique set of issues and challenges that the surgery addresses. So our goal in putting this program together was to have one place that these patients can go to have a tailor-made surgical plan, so to speak, with realistic expectations, a realistic timeline that will take the patient from beginning to end. Initially seeing the patient, assessing what their issues are, discussing what their goals and expectations are, seeing if we can realistically address them.
So you're lifting the body, or you're cutting out the skin? And what do you call it, by the way? Is it a body lift? Is it a skin lift? What is it?
Well, a body lift is one of the many procedures we do. A body lift describes a 360-degree excision of skin, mostly around the waistline, that will do two things. It will lift the lower part of the body up, as well as tighten the abdomen and flanks.
Like a big tummy tuck.
Yeah, a little bit more extended, obviously, than a tummy tuck because it goes all the way around.
Wow.
But there are some patients that only require a tummy tuck in terms of, with respect to that area of the body. Some patients require an extended lift or extended tummy tuck that goes almost 360 degrees around if they don't have lower back and buttocks issues. And some patients require the entire lift. Now, women will come in, they may or may not need breast surgery, and the breast surgery can be a lift, can be a lift and an augmentation, can be a reduction. there's no typical patient.
Not a lot of plastic guys are doing this, by the way, because I interview a lot of doctors. Why you? Why do you like the surgery?
This is many plastic surgeons or cosmetic plastic surgeons shy away from this because it's challenging. The patients require a lot of follow-up, and there are certain issues and that have to be addressed that are very time-intensive that you don't have with your typical cosmetic surgery patient, like a breast augmentation. Those patients get operated on, have several follow-ups, and move on. These patients.
So why do you like that?
This population is unique to me, and the sense of gratification I get out of successfully treating one of these patients,
like
or
a happy
helping
group, happy group of
them.
patients.
They're very grateful, and it's one group that I actually feel that I do something that's substantial for. It's a life-changing thing. Now, cosmetic surgery patients, you get that as well.
Okay.
So I'm not minimizing that in any way. But with this group of patients, you're doing something that drastically alters their quality of life. And I feel it, and I feel the gratitude.
Because you're a fitness guy. I mean,
Right.
you're in world-class shape. There's no doubt about it.
Thanks.
So is that why? I mean, you're helping these people get back in shape.
It's more of a spiritual thing than
Really?
a vanity thing. Yeah, for sure.
Okay, so they get the surgery. They lose 50 or 100 pounds. Are they counseled by the doctor that does the bypass or lap band on who to go to?
Well,
how do they hear about it?
At this point, the surgeons that are actually doing these procedures are not making these direct referrals or suggestions to their patients. As far as I know, I don't get most of my patients through those channels. What I do get are patients that hear about me through chat rooms or support groups from other patients I've operated
The patients
on.
say it's hard to find a plastic surgeon that wants to do the surgery. I talked to one of your patients. He says there's a lot of guys that can do it. They just don't want to do it.
It's a challenging patient group to work with because the follow-up required is extensive. But most of my patients hear about me through other patients who I've operated on, usually through their support groups, or they actually have chat rooms online that they talk about their experiences with. And that's where I get most of my referrals right now.
Now, I have a lot of questions about this,
Okay.
but you brought some photos.
Right.
Let's start there.
This set of pictures here is of a very important patient, and you'll understand why because you're going to meet him.
We're going to meet him, yeah.
You're
He's
gonna meet
coming
him
up
shortly.
after the break.
But he came to see me after seeing several other plastic surgeons, and he was very frustrated because his quote was, "They just don't get it." And
Really?
Yeah. And what he meant to say was, here I am. I've lost all this weight after having this big surgery, and look at me. I'm not happy because I have a new set of problems and challenges that I'm faced with.
The lax
skin, correct.
Okay.
And he brought me a picture of himself, which is really dramatic, of himself before
Jeez.
weight loss surgery. Then the next photo he brought was a picture about a year and a half out of himself after having
Let me
lost
take
all
a
the
look at
weight.
that.
And it's pretty dramatic. And you say, wow, he looks a lot thinner, but his issues are obvious. All right, he said, this skin interferes.
So he lost 155 pounds.
Right.
So this is what they look like underneath.
Right, and he said, I still don't fit into clothes as appropriately as I could. I can't exercise because I get spasms from the skin and discomfort from the skin moving around, and it interferes with all other parts of my life, including intimacy. It interferes with his self-esteem, etc. And he wanted a plan. He wanted someone that was willing to go down this road with him to help him get to where he wanted to be.
Now, when you see this, by the way,
Right.
do you get excited? I mean, you're on the consult, you go, boy, he'd be a perfect candidate.
Yeah, I see the end result in some ways, but I also say, hey, here's a person who needs help, and I'm willing to do it if he's willing to take a chance on me with this.
Okay.
And because of my experiences with Jay, that's his name, we decided to sort of put this program together, and we talked about it loosely at first, and then after his surgery and his experience, he was motivated enough to really pursue me on this, and that's why we're here today, to talk about this program that we've put together that's unique, that will service this unique population.
For massive weight loss.
Right. And here's a picture of him after his surgery.
Wow.
And you'll see it's very dramatic.
Looks fabulous.
I mean, he's changed. I've watched him change before my eyes over the course of the last 8 months.
I met him in person yesterday.
You know.
You'd never think this guy was ever heavy in his life.
That's what's giving me most of my pleasure. It's the response, and it's the effect that I get to appreciate, in these patients' lives.
Now, we're going to hear it from him right after. In a few moments, we're going to bring him on stage after the break. You have some women.
Right.
What are we looking at? Wow.
This
Oh, boy.
is a 36-year-old woman who was heavy most of her life, and she had gastric bypass surgery. She lost about 170 pounds. Very pretty woman, very attractive, but didn't feel that way.
So this is after the weight loss.
That's after the weight loss, and you can
unbelievable.
Right.
Is this common?
Very common, but they hide it.
You don't see them. I guess
and,
I don't see
they're a lot healthier because they've lost all the weight. However, they don't feel that they're living their life to the fullest because of the skin issues.
Okay.
And it's not only a cosmetic issue, like I said, it is a functional interference in their day-to-day lives. And it's just because of lax and excess skin. And we did both a breast lift and an extended abdominoplasty on her, and
What
the
a
results
difference.
are dramatic. I talked to this